I'm really pleased to be talking about shame and body dysmorphic disorder. Just to give you a bit of context, this is something I've become interested in relatively recently. So my background is as a clinical psychologist, and I worked for many years in a specialist OCD clinic, and it was in the OCD clinic that I first started treating young people with body dysmorphic disorder. And when you're working with young people with OCD, the treatment is very heavily anchored in anxiety, the emotion of anxiety. So understanding what anxiety is, learning how to overcome fears by confronting them. And if you face your fear and stick with it, your anxiety subsides and eventually extinguishes altogether. And so I started, when I was working with body dysmorphic disorder, initially working in a fairly similar way. And for some people this worked brilliantly well, but for other people it became very apparent that anxiety actually wasn't the main emotional experience that they had. And in fact, they were telling me, no, I don't really feel anxious when I look in the mirror, I feel shame. And shame doesn't necessarily follow the same pattern that anxiety does. When you lean into it, when you confront it, it doesn't necessarily sort of fizzle out over time in the same way. So this got me interested in trying to understand shame better, and particularly its implications for treatment. So I'm going to start with a little bit of a caveat, which is that there hasn't been a huge amount of research on shame in body dysmorphic disorder, unfortunately. But the good news is that there, I think, is increasing interest, and really kind of in keeping with the theme of this conference. Over the last 10 years, there have been an increasing number of studies and publications on shame and BDD. So I'm going to be summarizing some of those findings today. And I'm going to be arguing that I think that shame is really central to our conceptualization of BDD. I think it should be a research priority, and I think it can have important implications for treatment. So this is roughly what I'm going to cover. What is shame? So how can we understand it? The relationship that shame has with body dysmorphic disorder, and also why it's important. What is its significance here? I'm going to talk a little bit about where shame might come from, so what its origins are. And then in the end of my talk, I'm going to talk about shame in treatment. So what is it that we can do in treatment to target shame? And just a little bit of a warning that in a couple of places I will touch on some more distressing topics, particularly suicidality and trauma and abuse. So I'm just mentioning that now in case anyone feels uncomfortable listening to that and would prefer to either leave or sort of just not focus on the slides at that point. So what is shame? I've mentioned already that it's an emotion. I compared it with anxiety. In the literature, it's talked about as a self-conscious emotion. So self-conscious emotions are defined as emotional experiences that are really linked to how we see ourselves and also how we think other people see us. So there are two really important components there. One is this kind of self-judgment component, and the other is the sort of social or interpersonal component concerned with how we think other people are perceiving us. So other examples of self-conscious emotions include embarrassment, guilt, jealousy, and there are also some positive self-conscious emotions like pride. Guilt and shame, I think, can often be confused, and they are quite closely related, but they are different, and I would argue that shame is the more sort of toxic and burdensome of the two, because really with guilt, it's linked with a thought that you've done something bad. So you've made a mistake, you've done something bad, and it provokes this feeling of guilt. But with that belief, there could be a sense that you might be able to correct the thing that you've done, you might be able to make up for it somehow, and you might be able to make different choices in the future. So it could be a relatively circumscribed event and set of feelings. Whereas In contrast, shame is linked to beliefs about much more pervasive self-concept and this feeling that you are bad, that there's actually something wrong with who you are as a person fundamentally. So people with high levels of shame tend to describe themselves as seeing themselves as intrinsically flawed. So who they are at their core is flawed or defective in some way. And with that comes high levels of self-criticism and self-judgment, and also often this urge to want to kind of hide away, to disappear and withdraw. And when we think about this definition, I think it's very easy to immediately see the links, the synergy with BDD, because of course people with BDD do view themselves as flawed, particularly in relation to their appearance. Of course, high levels of self-criticism are commonplace in BDD, and high levels of sort of withdrawal, for example, from social activities, from work, from leisure activities. So you can instantly see the parallel. And in fact, if we look back to some of the very early descriptions of BDD over 100 years ago, they talk about shame. So this description by a French psychologist, Pierre Janet, he described body dysmorphic disorder as an obsession with shame of the body. So here he's highlighting body shame and putting it as the core feature, the defining feature of BDD. But of course this is a sort of clinical description, a clinical observation, so it's really important for us to look at the research and see what that shows about the relationship between shame and BDD. So I guess the question is there a relationship that's borne out in the research? And the short answer is yes, but I'm going to talk about a couple of studies to highlight some particular aspects that I think are important and sort of add a bit of nuance really to this relationship. So the first point that I want to mention is that although Pierre Janet talked about body shame, it seems that people with body dysmorphic disorder are likely to experience more generalized shame. So it's not just shame about how they look, but it's actually a broader, more pervasive shame about who they are, their personality traits, other characteristics. And the other point that I want to mention is that there may be some kind of specific relationship here or an element of specificity, because a study that compared individuals with BDD to those with OCD found that internalized shame was correlated with body dysmorphic disorder symptoms in those with BDD, but not with OCD symptoms in those with OCD. So this suggests that shame might be more closely related to BDD than it is to OCD, for example. But why is all of this important? Is it really, does it matter? And again, I think the short answer is yes, it does. And I'll show you the results of a few studies just to highlight why I think it's important. So a study by Hilary Weingarten and colleagues in the US looked at shame, general shame. So not, this isn't body shame, but sort of this more pervasive general shame in individuals with BDD, and found that it was associated with functional impairment. So this is impairment in day-to-day functioning. And if we think back to the earlier definition, I think perhaps that isn't surprising. It makes a lot of sense because shame tends to trigger this urge to want to hide and withdraw. And so, of course, it's going to lead to more restricted functioning and make it difficult to, for example, get to work or see friends. In the same study, they found that shame was also positively associated with symptoms of depression and also suicide risk in individuals with BDD. So again, I think this is very much makes sense when we think about that definition of shame involving self-concept and a kind of a belief that you're somehow intrinsically flawed it makes sense that it might then render somebody vulnerable to developing depression and suicidality. And importantly, studies have also highlighted that shame is a significant barrier. In fact, it's one of the biggest barriers that people with BDD describe to them seeking help, to asking for help with their difficulties. And as has been mentioned several times during this conference today already, this is a real major issue. The majority of people with BDD don't come forward and ask for help. So it's really important that we're sort of understanding these barriers, and shame may be one of the big ones. So all of the studies that I've just talked about are cross-sectional in nature. So that means that they were carried out at a single point in time, looking at associations at a single point in time. So they don't really tell us about the direction of the relationship between shame and BDD. And one of the important questions is shame a cause of BDD? Might it be a risk factor for developing BDD? Or is it a consequence of having the symptoms of BDD? They generate and provoke this emotion of shame. So thinking about the relationship that way round, so BDD leading to experiences of shame, this is put forward in some of the cognitive behavioural models of BDD, and it certainly fits with first-person accounts of BDD. That people will often describe, for example, that when they look in the mirror, it really provokes this sort of feeling of shame. In terms of the evidence, there's some longitudinal studies that I think fit with this. For example, this study, again by Hilary Weingarten in the US, she looked at a group of people with BDD who were receiving treatment with escitalopram, which is an SSRI, over 14 weeks. And what they found is that shame reduced over the course of treatment, but also importantly, shame reductions were significantly greater for the treatment responders compared to the non-responders. So this potentially fits with the idea that BDD symptoms reduce, and that has a knock-on effect on shame. Thinking about the relationship the other way around, might shame be a risk factor for developing BDD? As far as I know, there haven't been any studies directly testing this hypothesis, but there have been some longitudinal studies looking at whether shame might predict other emotional difficulties at a later time point. For example, this study that we carried out in a twin cohort, we looked at shame at age 15 and found that it predicted the emergence of new depressive symptoms and anxiety symptoms at age 17. But the strength of the association was much stronger for depression than it was for anxiety. And I think this is really interesting and might sort of help us understand BDD, because depression is a condition that's characterized by this negative self-concept that I was talking about earlier, and it has that in common with BDD. So what these results might be showing is that shame is a risk factor for developing disorders or conditions or symptoms of conditions that are defined by negative self-concept, so sort of disorders of the self, as it were. And of course, both of these relationships may be at play. So it's perfectly possible, and I think even plausible, that for some people, shame predisposes them to developing BDD symptoms, but then BDD symptoms feed into and amplify the emotional experience of shame, which then further fuels BDD symptoms, setting up this vicious cycle that then escalates over time and to a point at which an individual meets threshold for a diagnosis of BDD. So I will move on now to talking about origins of shame, and I guess this is interesting because if we're saying that shame might, for some people, precede the development of BDD, then it kind of begs the question, well, where's shame coming from? What are its origins? Why do some people have high levels of shame and other people don't? So in the same twin study that I mentioned a minute ago, we were able to look at the etiology, the sort of origins of shame in our 15-year-olds, particularly to differentiate the genetic and environmental influences. And what we found was that about 40% of the variance in shame was accounted for by genetic influences. So there seems to be some kind of genetic predisposition to experiencing shame. Just to clarify, that doesn't mean that you're born kind of hardwired to experience shame, but it's a predisposition in the same way that you might be genetically predisposed to being musical, but actually your environment has a massive impact on whether you become an accomplished musician or not. So there's this genetic predisposition, but the bit that I really want to highlight is that actually the majority of the variance, almost 60%, is accounted for by environmental factors. And of course, the sort of million-dollar question is, what are these environmental factors that might be shaping shame? And when we look at the literature, I think that the kind of category, the group of environmental experiences that are talked about the most and that come through the strongest is interpersonal trauma. So the idea that some sort of negative interpersonal experiences, abuse, neglect, bullying, for example, might contribute to this sort of development of shame. And when we look at interpersonal trauma in BDD, there is a much larger now emerging literature to suggest a relationship here. So, for example, in a survey study where people with BDD were asked if they thought anything had triggered the onset of their BDD, the most commonly reported triggering event was bullying, peer victimization. And quite a large number of studies have now looked at adverse childhood experiences more broadly, so abuse, neglect, bullying and teasing. And this meta-analysis by Longobardi, which was published a few years ago, summarized the results of 27 studies and showed that all of these experiences, abuse, neglect, bullying and teasing, were associated with BDD. So again, this is not directly evidence for a link with shame, but it sort of starts to put the pieces of the jigsaw together, showing that perhaps some, not all, people with BDD have experienced this interpersonal trauma. Perhaps that generates shame, and perhaps that's one of the factors that feeds into the development of their BDD. A caveat here with these studies is that they were almost all conducted in adults. So they were asking adults with BDD to look back, think back to their childhood and report on what had happened. And obviously that's problematic because not everyone can remember accurately. There might be biases in what they remember. So we carried out a study looking in young people, and we looked at the rates of adverse childhood experiences in a group of young people with BDD and a group of young people with OCD. And these are the results. And you can see that people with BDD were significantly more likely to have experienced teasing or bullying, significantly more likely to have experienced any trauma, so that's abuse or neglect of any type, and also significantly more likely to have experienced multiple traumas. So again, suggesting that there's something about these interpersonal experiences that are more strongly linked with BDD than OCD. So for the final part of my talk, I'm going to move on to thinking about how we can address shame in BDD treatment. And as I'm sure you're all very familiar with, the evidence-based treatments, the recommended treatments for BDD are cognitive behavior therapy, a particular type of cognitive behavior therapy, and SSRI medications. And we know that both of these are effective in reducing BDD symptoms. But I think an interesting question is, do these treatments adequately address shame? And I think possibly there's some impact. I mentioned this study earlier, which was a study of escitalopram, which showed that shame improved over 14 weeks. the effect size there was medium to large, so showing some benefit. A study looking at CBT, which I think is really interesting, found that shame mediated the effect of CBT on BDD symptom reduction in the second half of treatment, so that's between weeks 13 and 24, but not in the first half of treatment. And the authors of this study sort of talk about why that might be in relation to their treatment manual, and say that it's probably because the early stages of treatment don't target shame. They are addressing psychoeducation, individual formulation, and targeting behaviours related to BDD, whereas in the latter stages of treatment, some techniques are brought in that do address kind of core beliefs, negative self-concept, and therefore possibly shame, and that might explain this sort of temporal relationship that they're finding here. So an example of the kind of technique that they would use in the latter stage of treatment is a self-esteem pie chart, where a clinician might ask somebody with BDD, how do you judge your self-worth? What is it that, how do you rate yourself? What do you judge yourself by? And typically most people with BDD early in treatment will say that their appearance is really the main metric by which they measure their self-worth. And the therapist then encourages them to think about what are your other attributes, what are some of your positive attributes, what might a friend or relative or partner sort of say that they value in you, even if you don't value it in yourself. And the idea here is just to reduce importance that's placed on appearance, but also develop a broader self-concept that's not defined by appearance and that's more positive self-concept. So given this kind of close relationship between self-concept and shame that I talked about at the beginning, this may well be an effective way of tackling shame for some people. But it's rather indirect. So I'm interested in whether we can target shame more directly, more head-on in treatment. Of course, it's impossible to sort of target any emotional experience completely directly. If you have the experience of somebody saying to you, oh, cheer up, if you're looking rather sad, you know that it's just irritating because you can't switch your emotions like that. So when we target emotions, it's always via cognitions, thoughts, and behaviors. So by changing thoughts and behaviors, that's how we change our emotions. And there have been a few studies in recent years that have talked about particular techniques that could be used to target shame in BDD. And those are a few examples. Some of the key strategies that come out are imagery rescripting of shaming experiences. So thinking about those possibly interpersonal traumas that have been shaming and humiliating, a particular technique called imagery rescripting can be used to help individuals reappraise what happened to them, to think about it in a different way, to develop kind of compassion for themselves, their past self, and what happened to them in that moment, and to also contextualize that memory as something that happened in the past, and to put it in the past rather than kind of have it bothering them as an ongoing threat. Developing self-compassion is obviously a big theme, and Professor Paul Gilbert is talking about that at the moment, in fact, so I won't go into detail, but essentially here it's about recognizing your own suffering and trying to respond to yourself in the way that you would respond to a friend, for example, if you saw they were suffering. So developing that kind of almost caregiving role towards yourself. And lastly, kind of reducing critical thinking. So again, at the beginning, I talked about how shame is linked with this very high levels of self-criticism. And so reducing self-criticism, one approach to that is by helping people spot that, to almost conceptualize and think of that as being like an inner bully, and to learn to stand up to the inner bully. And of course, a good way of standing up to bullies is by walking away, and so you can do the equivalent of that with your inner bully by trying to sort of ignore the thoughts and learning to not let them control you. So in terms of future steps, I think it's really important that we have longitudinal research looking at whether shame does predict the development and emergence of BDD. And part of why that's important is because it could indicate an opportunity for early intervention or even prevention. In other words, if we can reduce shame, might that reduce the chances of somebody developing full-blown BDD? I also think it's really important for us to start to try and disentangle effective elements of treatment. So the techniques that I just mentioned on the previous slide are all compatible with CBT. They're often used in CBT, but at the moment we don't really have the research to know which aspects of CBT, including these shame techniques, are helping, which ones are conferring benefit. So I think being able to sort of disentangle that is really important to help us optimize the treatments that we're delivering. So this is my penultimate slide, and excuse the terrible pun, I thought it was funny at the time, a shameless plug. We're recruiting for 2 studies on shame in BDD at the moment, and if you're interested in taking part, either with lived experience or not with lived experience of BDD, please look out for our research stall in the main hall. And I'm just going to finish now with a quote from somebody with lived experience of BDD who can sum up a lot of what I have said in a much more eloquent way than I ever could. So she said, shame, it's got to be up there as the #1 feeling. For me, I feel shame about having shame about the way that I look. It's something that latches onto everything. And I think that when you have such deep shame, you're kind of predisposed to seeing everything in such a negative light. For me, it's the biggest driving force in a lot of what makes me feel like I need to hide away and change the way I look. Thank you very much.